All right, so another update. So just a few minutes ago, the World Health Organization just warned, quote, "This is not a drill," unquote, in terms of the coronavirus as it has approached 100,000 cases. It's at over 98,000, and it'll easily hit 100,000 sometime today of confirmed cases. So I'm going to show a graph. We're looking at numbers outside of China. So we have the complement of China, meaning the rest of the world outside of China, in terms of numbers of, where the confirmed cases are. This is 5 a.m. today. Where they were yesterday, the increase, that's at 5 a.m. yesterday, the increase in the number of cases where they were 7 days ago, a week ago at 5 a.m. And we could see how these numbers have increased, where, some countries, they're cracking down on it, or they're kind of making artificial numbers, as we kind of see in China, or other countries like Germany, where it has rapidly increased in the last 24 hours or the last week, where it's increased over 1,000%. And countries like Germany, I'm showing the death toll, the mortality rate, etc. So we could talk about that more later, but right now, this warning just came from WHO. And it won't be long until we reach 1 million cases globally. It wasn't long ago that we were at 10,000. It wasn't long ago that we were at 100 in China. So the Congress in the U.S., bringing specifically back to the U.S., is going to vote on a bill today. It's a funding bill for the coronavirus that gives that funds the response to the virus for $8.3 billion. So $3 billion of that will go towards vaccines. And we know that, or we expect, because Trump did a open discussion with a bunch of pharma companies, pharma executives, where they discussed how quickly they can have that vaccine ready. They were talking more about phase 1, which Trump wanted more of an overview of when it should be available to the public, which the outcome of that was a lot of people were saying mid to late next year. And that we already know from the CDC that this can be an annual thing, kind of like influenza or the flu, where this is going to hit each year. I don't know if it's going to be the same timing, like October to March, like the flu is. But we expect this to start dying down next month in April. Could be end of April, I'm not sure. But that was reports from that I've read from several days ago. So that we'll have to keep updating on that. But $3 billion towards vaccines, 300 million of the $8.3 billion U.S. funding bill for coronavirus. 300 million of that will go towards related drugs. For instance, like for people who get the virus. 2 billion will go towards government response at different levels. So that'll go toward, basically the federal government will be making funds that be available from that 2 billion for like states, because we now have 17 states in the U.S. that has at least one confirmed case of the coronavirus. So $2 billion will go towards states and local governments. For instance, there's like pandemics in very specific cities, like around Washington, Seattle, Washington, LA, and right near Washington, Toronto, but that's not in the U.S. obviously. We're seeing things pop up in New York City and that area, Boston, just to name a few. So 200 billion towards the government response at different levels. Another 300 million will go towards funding the CDC's response specifically, which makes sense. 1.3 billion will go towards helping fight the virus overseas, and then basically much of the rest of the funds will go towards medical supplies. So we got 300 million towards drugs, and then much of the rest of that 8.3 billion for the funding bill for the coronavirus will go towards medical supplies. That might be that is going to encompass masks, things of that nature. That might encompass testing kits. I imagine it would. I know Washington State's trying to expand what they can do, bringing in University of Washington and Seattle to try to help double the amount of testing they can do per day. because it was 100. They're trying to make it 200 tests, which isn't many at all. So we're going to need more testing kits, especially if this keeps increasing over 20% within the U.S. in terms of confirmed cases each day. It's going to grow rapidly. So that's an update about what we're seeing. That's going to be voted on today, i.e. Friday. It's about 6:30 a.m. So we have information that 2 teachers, 4 adults in New York City, and dozens of students went on a trip to Italy, northern Italy. I believe that's where it's getting hit the hardest, as northern Italy in terms of Italy in general. Many of those people are in quarantine. We already know that there's been a huge jump in confirmed cases, where it was basically 0 just a few days ago. That it's rapidly increasing, and these people are in quarantine, which, as we know, people can be asymptomatic for weeks. I think the average is anywhere from 2 to 5 days is typical, but that's a report that I read about a week ago. But people can be not showing any signs for weeks. So with these several people coming from northern Italy, these are students, teachers, and whatnot. We know that some of these people could have the virus, and they could have spread it since then. It was a winter field trip from what I've read, and that's going to be troublesome as New York City is so greatly dense in terms of population per area. So we see that also the stock market is reacting to all this in a very I guess whiplash way, where we see improvements, then we see declines, and back and forth. We'll see how this ends. I think it's a good time to buy, honestly, especially if this virus is going to peak at sometime in April. So anywhere from like a month to 2 months, 4 weeks to 8 weeks around that time frame. I think the stock market will rebound to almost where it was before. Obviously, we see production hurting greatly in countries like China from the coronavirus. But I think as production comes back, I think we'll see huge gains going closer to where we were just a few weeks ago, or just several days ago. So there's there's a university in China that has been studying the virus and seeing, looking at mutations, and now we know that there's a type L, and I forget what the other type is, but the type L is the more aggressive one that encompasses, specifically for China, that encompasses 70% of cases. Obviously it's expanded outside of China, so it may be that in terms of like Iran and Italy, we could see a harder strain where it may have mutated. So 70% of cases in China, roughly 70%, are that type L mutation of the COVID-19, where 30% are that other type. So there's 2 strains, 2 mutations basically that they're looking at, where one is far more aggressive than the other. And South Korea could have that weaker mutation, or it could have mutated since it has left China. Could have mutated several times. Could be, Iran and Italy have that harder mutation, or it could be mutated in each of those countries differently in a negative way. Usually mutations, which we've seen with Ebola, mutate in a positive way for humans. That happens most of the time. But in this instance, it could have separated. It seems like a very fast-moving virus in terms of different ways, and how it can possibly give different strains. As I said before, in Washington, we believe it could have been there for up to 6 weeks. I guess that would be 6.5 or 7 weeks now. But so the reason is we can look at small changes and the formation of the virus. These are insignificant, so these aren't going to be mutations that make it more or less aggressive. Very insignificant, but it does show a timeline of how long the virus could have been in a certain area. I think that's very significant. So we also have the first case in the Vatican. There's a lot of old people. The Pope has been sick for quite a while. A lot of old cardinals and whatnot. I'm not Catholic, but we know Rome, or Italy in general, has been hit very hard, and if it hits the Vatican, we can expect a very troublesome outcome. Along with that, there's been a rabbi that's been, I believe he's been tested positive for the COVID-19 in New York. So that just, such religious leaders generally come in contact with several people. We see this happening in Iran, how people are licking the shrine, and religious leaders are spreading the virus, not on purpose, but that's something to think about. So going back to this chart that I made, as I said before, we have 17 states in the U.S. that have at least one confirmed case. And as I said before, it's asymptomatic, meaning that there could be hundreds of more people in several more states that could have confirmed cases within the context of the U.S. So we see, like I said before, South Korea could have a weaker strain of the virus, the complement of type L that we saw from the China, what they've been studying at a university in China. Italy could have a harder strain. But we see, as I've been doing these videos, we've seen outside of China, the spread of confirmed cases has increased about 20%, roughly, a little bit over 20% most days. That's every 24 hours, it's increasing just over 20%. So that's going to be, after 4 days, you're more than doubling the amount of cases easily, and of confirmed cases outside of China, and that's very very troublesome. But we see in South Korea, it's going to be much lower, where it's not even doubled within a week. In terms of the world, well, it's not even tripled within a week. So we're looking at increases. So 8.3% increase in the last 24 hours. So that means it's went up times 2.8 to 1 in the last week for South Korea. And in the U.S., we've been seeing the upper, high 20s in terms of confirmed cases, increasing in the upper 20%, which we've seen a 46.5% increase in the last 24 hours. That's more of catching up to people we need to test, because we're not testing a lot of people because it's very hard to. We get these results back the next day. We have to test people twice. A lot of these tests aren't very accurate, which, at first they could be far more accurate now, hopefully so. As I said before, we've missed cases from tests coming back negative, which really they did have the virus, like someone in California. It could have spread it further. Now we've seen the UK, United Kingdom, has been hit very hard lately. They just had 0 cases a few days ago. Now they're at 116 confirmed cases. They've had their first death from the coronavirus. So we see it going from 0 to UK has about 10% of the population as the US, I believe, about the same as Canada, roughly, plus or minus a few million here or there. And we see that that's just went from 0 to 116 and confirmed cases that quickly. We see similar things in Western Europe, as I said before. It looks like Western Europe's going towards a bad direction in terms of confirmed cases and deaths. Since I've said that, we've just seen epidemics within Western Europe, in terms of Switzerland, UK, France, Spain, and etc. And then throwing, Italy for Southern Europe. And hopefully, that we see what's happening in Turkey, where all the refugees are going through, trying to hit up Southeast Europe. And I know in Africa, in terms of economic refugees, a lot of them travel through the water to Italy, and I don't know how that's going to be affected. I know every once in a while there are rafts and boats stopped. I don't know how it's going to be affected if there's like once it starts getting warmer, if there's another mass the economic migration in terms of economic refugees, how that's going to work is it going to be a push factor pushing such economic refugees away from Europe, because they usually go through Italy, and we have the Dublin, I think it's the Dublin Agreement, with refugees, meaning that they're supposed to stay in the first country that they go to, and then organize from there. So are these refugees really going to want to go to Italy, where the coronavirus has been spreading like crazy? It hasn't hit, I think it's hit Ecuador pretty bad for South America, but other than that, it's not really hit South America or Africa very hard. So that's just something to keep in mind. And Norway's went up like crazy. Sweden has increased quite a lot in the last week. Norway has went up about double and almost double in the last 24 hours. So Northern Europe as well, we see this expanding quite. Europe, especially with the EU nations, they have a pretty open policy when it comes to traveling. It's very easy to travel. I've toured there, where I've been in a bus and I was asleep the whole time. For many times that we went through countries, like traveling across the border to Poland, for instance, they don't check your your passport across the border, and with that, it would be very easy to spread the virus, for instance. So that's something to look at. I'm gonna see if there's any updates on CNN, which that WHO update just happened not too long ago. So Czech, going back to Europe, their health minister urges EU to be more active to stop virus spread. We see a lot of information about warning people not to go to mass social gatherings, that sort of thing. We've seen that days ago with the Washington governor saying that for Washington State, where we need to look at avoiding social gatherings, huge social gatherings like concerts, parades, parties, and even possibly schools, which now we're seeing they were giving the command of closing schools to the school districts, the school boards, that sort of thing, and now we're seeing more pressure for these schools to close in Washington specifically. I know in Italy we're seeing a lot of schools close. In Japan, over a month for basically all public schools are closed. Still not sure if they're going to push the Tokyo Olympics back. I know they moved the marathon. I don't know if that was due to the coronavirus, maybe to a less populous area for crowd size and social gatherings, going back to that. But that's something to look at. But if it doesn't, I think the Olympics last about 2 or 3 weeks. If it doesn't start in early to mid-December, it's just going to be canceled altogether. But I would not be shocked if they moved the date at all. So yeah, it's pretty rapid moving virus. It's I think I've read that I think the CDC said the flu from case to case, from person to person, each person spreads it to 1 to 1.5 people. With the coronavirus, it's from 2 to 3.5. I believe that's the numbers that the CDC claimed, and these numbers that I use on the chart, those come from Johns Hopkins, so they're very accurate numbers. So if you have any complaints, I can send some resources and to back up my claims, and from there, we'll see how it plays out today, and I'll probably come back tomorrow and do a similar video. I don't know if I'm gonna make the chart or not, but I think it's very informative, very eye-opening in terms of showing where we are And just CDC. I think it was so it might have been HHS or CDC. I forgot. They made a list of products to look at getting that are good at killing the virus. Like shopping carts. They have those wipes that you can wipe down to help stop colds and stuff like that. So it's gonna be informative. Different places or making it so that you can only buy a very limited supply of like Germex and that sort of thing. Make sure you get at least 60% alcohol whenever you get hand sanitizer. CDC said if you're gonna wash your hands, which you need to start doing that more and more often, at least 20 seconds thoroughly in warm to hot water, and avoid shakes. Avoid, especially in public and in social events, avoid putting your hands to your mouth, nose, or eyes. So some different things to think about. If you're gonna go shopping, like I said before, plenty of times, medication, fluids such as water, calories, and then luxury items, and then like medical items as well. So I would look at different scenarios. Worst case scenario, you get the virus and there's an epidemic, meaning that the stores are raided. Well, you're going to want to have fluids and calories beforehand. So just trying to think ahead, like chess moves. Think a few steps ahead at the very least. But you're going to definitely want some medication. So medication generally lasts at least a year. So the medication that you want, from what I've read from the CDC and HHS, is the same medication that you would get for the flu, especially if you have a milder case. Quarantine yourself if you believe that you could have the virus. Go get yourself checked out. And medication for the flu and the pneumonia. Those are medications that you want to look at, since there's no official medication specifically for the coronavirus. And from there, we'll see how this plays out in the next 24 hours. But we're easily going to hit 100,000 cases today, and we'll see how this goes.